So I'm going to present today about regional treatment for tinnitus using LP-PRP for my research. And I'm going to show you long-term clinical experience with my treatment. If you still have some more questions at the end of this presentation, you can send me email. My email address is ShimSPOT-Guided. Why an inner-ear regeneration may be possible? There will be limited spontaneous recovery in this inner ear field. Once sensory halos happens and tinnitus rarely recover fully, right? And there will be very limited sources, limited regional violent sources, and we have to target the very small limited violent targets like the remnant hair cells and the remaining sinuses, something like that, all the environment. By adding some soluble factors, that is our goals. And once trophic collapse happens, the hair cell losses happens, and there will be some release trophic support, and that result in progressive neural deteriorations. So some of you guys try to inject intravenous cells to restore immune cells, but you will struggle to contract some problems. Most of these stem cells will be trapped in the lungs, and the remaining small portion of cells will be blocked in the blood-lungs area, right? So meaningful area delivery is very difficult by this way of treatment. So instead of that, I am using intratympanic pathway. So I inject my PRP or blood marrow or even stem cells injected through hepatic eardrum and the right spot. So the injector factors or PRP inside our eardrum stem cells, things like that, will be diffused through the round window, right? Round window, and that is the target of our treatment. And the soluble viral factors, not the cells, will reach in the ear. So round the window membrane is a molecular filter, so any large molecule, any large cells will not pass the membrane. Only very small molecules will pass. So growth factors or exosomes, EVs, or something like that will pass around the membrane, but unfortunately, any stem cells cannot directly pass around the membrane. So I am using LP-PRP and bone marrow extract as well. That true thing is very similar characters, only some more growth factors are inside the bone marrow extract. Repeated treatment matter more. So if one moderate by 10%, if 5 times of treatment, you will get 50% of improvement. So how tinnitus caused by hair loss? Once your hair cell damages, there will be some bigger signals from the inner ear, and your brain will receive the bigger signals and make some spontaneous neural activity. That is the sounds like hallucinations. That is the tinnitus. So if you want to eliminate the tinnitus, you don't want to add any extra sound, you don't want any extra electrical or magnetic signal. Just improve your hearing. That's it. That your tinnitus will be gone. So our target is constant, continuous tinnitus, not intermittent, not procedural. Okay? In headlight, especially your light source headlight, because you want to eliminate any shadow while finding on the eardrum using your background, right? And as ShimSPOT, this one is ShimSPOT is composed of two structures. And it will help you to find out the right eardrum, and it will help you to stabilize while you're injecting LP-PRP. So yes, two structure, outer structure and inner structure. Outer structure you can find eardrums using your headlight, and in inner structure you are experiencing and you are able to stabilize. That's how I do it. I'm finding out eardrums with double replacement headlight. Okay, find it. And insert your part. And injecting through the holes very stabilized your left side, and without finding a gain, I'm just eject again. So there will be sometimes some backfalls, and you might be surprised, but only middle years, only one cc cabbage, only one ShimSPOT. I am injecting from 3 cc or even 5 cc. So there must be some backfalls, but it doesn't matter because why? Because I am using these devices, right? But in my clinical data shows that improvement itself may continue for years after the end of last treatment, at the end of treatment, and even after for several years. So by combining these 3 cases, all we can see is that the average speed of improvement is around 30 decibel per year, and the aging is around 1 decibel per year, right? So you can apply this treatment for anti-aging presbycusis, remote in hearing field. Okay, this is has very significant meaning. And this is the last case this is my case. So while I'm preparing this presentation, I suddenly got illness. Yeah, I got stressed. And first I tried to get a steroid treatment, which is traditional way of treating this way of disease, and it results in only got worsening my hearing. So I asked my physician friend to learn this procedure and treat me. And after 3 sessions of PRP treatment, my hearing got back normal. This is my case. So I am a doctor and a patient as well. So today, for the first time in this conference, I'm going to show you my recent data publicly. Are you ready to see? Yes. Hearing threshold improved after LP-PRP treatment. Significant. Every frequency was significant. So literally every frequency, from low frequency to high frequency, all the frequencies is showing improvement. And not only acute cases, but also chronic cases showing statistically meaningful improvement. So improvement was not only acute, but also chronic. And even after more than 10 years of symptoms, patients got improved. Yeah, it's real. So here is 3 key findings. I'm going to close my presentations. Significant, frequently at